Hi everyone, my name is Martina Jones. I'm a registered nurse and director of nursing for Detox VIP and Future Now Detox. Thank you for attending. So we'll just, everybody's logging in, just taking a few seconds. Hi everyone, thank you for coming. Welcome, 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 welcome. So let's get started. Our objective for today, we're going to discuss our topic, which is our immune system. And one of the points that we want to hit on is how does our immune system work? Next, we want to discuss some signs and symptoms that we may experience that let us know that our immune system is compromised. Also, what steps can we take to improve this for ourselves, for health? What steps we could take, what food we could eat, what lifestyle changes that we could make to kind of improve our immune health for ourselves. And finally, how does Detox VIP, how do we help support you, um, with just getting back to that optimal level? So we'll discuss those four topics while we're here. So how does our immune system work? As a lot of you guys know, our immune system is a system in our body that recognizes when foreign objects enter our body. Foreign objects could be not like a wood or brick or stone. I mean foreign objects such as virus or bacteria. So when foreign objects get into our body, whether it enters from like our nasal passage or oral cavity, the body recognizes that something foreign has entered, and how is it going to get its cells to be able to fight that off? Your body's natural immune system fights off any invasions, and that's what protects us. If the body realizes, what it does is it sends out like white blood cells. A form of white blood cell would be like your lymphocytes that's in your body. Lymphocytes are a form of white blood cells, just like our T cells or B cells. So it sends out lymphocytes to attack these invaders. And when it gets there, if it's a virus or a bacteria that it has never recognized before, it kind of engulfs it, tries to break down that DNA of that molecular structure to try to figure out what is it. During this process of it breaking it down, it sends transmitters throughout the body to say, okay, then this is this object, this is what it's made up of, and then it tries to make antibodies for it. So this is what our immune system does. It gets that invader, try to decode the invader, and B cells gather all this information in our body. And like we said, it makes antibodies. So a lot of people, are discussing even the coronavirus that we have going on, that people are building up antibodies. So if your body comes in contact with this invader in the future, whether it's a couple months from now or years from now, it recognizes it and remembers what antibodies it made to help that fight it off before, and sends those out. So it kind of works quicker when your body recognizes that invader from previous times before. So it's amazing because it's just your body's way. It's like a computer. It's just your body's way of decoding what these molecules are and figure it out and make antibodies. A lot of people are giving back plasma, their antibody plasma. So that if you get in your body and you've never been like exposed to like something like COVID-19 before, and you get these antibodies in your body, if and when you do become exposed, they're hoping that these antibodies that you got injected in yourself will be able to fight it off, because your body didn't naturally make those itself. So that's kind of a snapshot of what your immune system does. Why we should pay attention to our body. The important thing that we should pay attention to in our body, there are a lot of signs and symptoms that contributes to a decreased immune system. Some of them that we could touch on is, as we know, Stress. Stress is a big factor. Anxiety, insomnia, chronic pain, restlessness, constipation, weight gain, meaning being obese, like that storage of fat that we have in our body, smoking, big major factor, drinking in excess. All these factors work in conjunction with each other or individualized depending on a person and helps to decrease your immune system. So what are some of the signs and symptoms that we may experience to let us know our immune system is compromised? Number one is fever. A lot of time in the healthcare setting when we work, you'll hear like your provider, your doctor, your nurse, or your practitioner says like, oh, if your baby has a fever, if you have a fever, give it some time before you want to take a medication real quick to kind of stop that fever. Fever is your body's way of saying something is happening and I'm taking care of it. Allow it time for it to work. So fever is a sign for us. Now, an elongated period of you having a fever for 2, 3 days, yes, that is not okay. Your body is going into overdrive. And we're going to talk about overdrive as we go in our slide because there's an amazing vitamin that helps that with that in our body, a vitamin and mineral that helps with that in our body. So as we go on, we want to hit on that topic. So, of course, like we mentioned, aging, smoking, drinking in excess, stress, anxiety. And fever is a sign and symptom that you may experience. Inflammation, cough, feeling easily fatigued, digestive issues, because our digestive system, there's our small intestine, large intestine that takes up all water. Large intestine, that's what it does, it's absorption. Our small intestine that also breaks down food. There's villi in your stomach lining that helps to absorb nutrients, vitamin and nutrients that we actually need for our body. People who have issues, compromised issues with their GI system, it's hard for them to get the substantial nutrients that they need from food groups. So a lot of times when they go into like the hospital setting or their providers, they'll offer them like IV supplements, IV treatment, because this is a way for it to get into the vein and it gets to a cellular level much faster because they have this compromised GI system, making it difficult for them to absorb all the essential nutrients that they need. No matter how much they eat, it's just going to waste and you're just excreting that from your body, which can also cause malnutrition. So it's vital that we protect our GI system, we protect our GI health, we pay attention to that, and it's just vital for us to get that under control. So GI issues is one of the big factors and signs and symptoms that you know your immune system is compromised, and also infection. So infection in our body is, of course, like, you know, if it's bacteria or virus that's get it into your cells in your body, and how we'll take care of it. So just knowing those things and what to look for. Most people know exactly when something is wrong with them. They seek medical professional help and get answers. If it's a bacteria, your doctor might put you on antibacterial medication. And if it's a virus, like any major virus, a lot of times they put you on antiviral medication. Or if it's like a common cold, sometimes it's just getting fluids in your body because you can't treat a virus with antibiotics. Antibiotics are for bacteria. You can't treat a virus, which is like a common cold, with that. So most of the time, it's just telling the patient, you know, getting fluids in your body. You'll hear them say, rest a lot, get hydrated, whether you're drinking a lot or your grandma will say, get some soup in or get some tea in. It's just getting fluids and stuff back into your body. It's also vital that if you have access to IV, that is also a way if you go into the hospital, they'll give you some fluids, whether it's a liter bag or 2 liter bags. So that's a good thing. Um, so those are things that could help our immune system, and what affects our overall well-being and our overall health. So we touched on this topic, what contributes to a decreased immune system. So you could see a couple bullet points that I mentioned previously, like the stress, insomnia, restlessness. Insomnia, of course, is just not being able to sleep at nights, difficulty staying asleep. Sleep is so important because studies have shown that people that get less than maybe like 7 hours sleep at night, it contributes to their overall decreased immune system. So it's vital. I know a lot of times we're so much on the go that we don't get that we don't get enough sleep that we should. So it's important to try to get at least 7 hours sleep. For younger kids, it's more important for them to get more, for their brain to just regroup and get things all aligned back. Um, Signs and symptoms, we mentioned easily being vulnerable to illness, GI health, GI issues, malnutrition, aging, poor wound healing, respiratory cardiac issues, as we discussed before. So, some sources where you could find like vitamins and minerals that help our body. Many nutrients are found in food groups such as fruits, vegetables, meat, and of course the fish family, and ensuring that we eat a well balanced diet. That's that's so vital because a lot of us are on some diets that take certain things out. I believe in like a well balanced diet because every essential nutrients and vitamins that we need um, comes in different forms. So just balancing out is so important. Some sources that are very high, of course, in vitamins such as vitamin C, B, zinc, omega 3, which is good for heart health. The fish family is very good with that, and antioxidants that fortify our immune system. So we could discuss like vitamin C. Vitamin C, like everyone has been talking about a lot now, is because it aids with our respiratory system and it prophylactically prevents like cold symptoms and influenza. This is the virus that attaches to your alveolar cells in our lungs. That's where oxygenation takes place, where the deoxygenated blood from your body gets taken to your lungs. The carbon dioxide gets taken off. That's what we breathe out. We breathe in oxygen. So if we have these viruses like cold viruses, influenza that's being attached to our alveolar cells in our lungs, it prevents this back and forth with oxygen, carbon dioxide in our lungs. So what vitamin C does is just aids in the respiratory system, prophylactically preventing these cold symptoms from attacking our body. Some food groups we all know that has high vitamin C is our citrus foods and also strawberries. A lot of people don't know that, but strawberries is very high in vitamin C also. And it could also found in our green leafy vegetables. Vitamin C helps and aids with iron absorption. So you'll see a lot of times, even your provider will say, oh, if you're on iron supplements, um, they'll tell you to drink it with orange juice because vitamin C does aid in iron absorption. So that's key and that's vital. We could also discuss vitamin E. Vitamin E also works in conjunction with vitamin C as an amazing antioxidant to help to with fighting off infection. It prevents inflammation. Inflammation, of course, is say for instance we get a cut or something and we have those invaders come in to that specific area. That's why sometimes you'll see that area becomes red or it's swollen. That's called inflammation. So it helps with that because your body can go into overdrive when it's trying to fight foreign invaders when they get in. It also helps with anti-aging. Vitamin C is a big component of that. Vitamin C we could find in nuts, almonds, sunflower seed, those legume family, peanuts, It's great for that. Another vitamin we could discuss is vitamin B6, which I love, and I also like niacin because these are what you'll find that helps your central nervous system and brain development. B vitamins, whether it's B1, B6, B3, B12, B vitamins are water soluble vitamins, almost like your vitamin C. Water soluble vitamins meaning that it dissolves in your body and you could excrete it. It's not fat solubles like your vitamin A, D, E, K. And that's a good acronym to kind of remember when you're remembering your fat soluble vitamins. It's A, D, E, K. So your water soluble vitamins, it's kind of hard to kind of OD on those or take it in excess because they kind of get excreted out your body through your kidneys. So your B6, which is a part of your B complexes, it helps with the central nervous system and brain development. It's also helped in the production of myelin. So a lot of people who study like nerve ending, nerve cells, myelin is what coats your nerve cells that sends neurotransmitters throughout our body. And this is that protective coating around your nerve cells, nerve endings, that helps with that. So I like that protector for our nerve cells. So that's good for that. And foods that you could find this in is, of course, again, our fish family. So fish, banana is a good source, which we know banana also helps with potassium, which is good for your heart. Of course, not in excess of any or not too less. Also, potatoes good. Your B12s is good for energy. A lot of people take B12 supplements. To help with energy when you're feeling like down, you're feeling crammy and so forth. B12 helps with that. It also helps because it aids in red blood cell production. Red blood cells is what carries hemoglobin and oxygen in our body. So vitamin B12 help with red blood cell production in our body and prevents anemia. Also, a water soluble vitamin, as we mentioned, it comes from the B group, and this is found in red meats, poultry, dairies, or eggs, stuff like that. That's where you'll find your vitamin B12. Another essential vitamin is vitamin A. As we mentioned before, A falls in the fat soluble vitamin category. It's an excellent source for immune system. It's good for eye health. Everybody talks about um, your retina for your eyes. Um, so vitamin A is good for that. Vitamin A is good for skincare products. I could tell you that no matter what a skincare product you're using, if you look in the back, most of the time the main ingredients in it is vitamin A. So it's great for skin health. Production of getting just our skincare regimen under control and just being good. The good way of just remembering your vitamin A's and foods good in vitamin A's are it's very colorful. Colorful. I think about eyes. I see how you see colors is through your eyes. So food groups with that's great source of vitamin A would be like your carrot, your squash, your pumpkin. They're very bright in color. They're a rich source of vitamin A. Zinc, of course, we use that a lot in our healthcare field, especially nurses that do wound care. Your provider sometimes will order zinc for patients' skin. It helps with wound healing. It helps to prevent wound. It helps to build those muscles and skincare to just prevent things from breaking down. So it also helps with reducing cold symptoms that's in our body. So it's not really a preventative measure, but it helps with reducing the overall time that you may have been exposed to like a cold virus or cold symptom. It's a great antioxidant, of course, and we mentioned that it's an anti-inflammatory agent. This is also found in like meats. You could also find it in like whole grains and shellfish. A lot of people are allergic to shellfish, so just make sure you take that into consideration. Of course, we know protein is building blocks made up of amino acids, and this is great for our muscles, our skin, our GI health. Protein is great for that, and you want to get substantial amount of protein in your body. Um, some vegetarian who may not be eating meat, they get their protein from like beans, the legume family. They'll get their protein. A lot of them get their protein source from vitamin D. Of course, we know the biggest form of vitamin D is sunlight. You want to get out. You want to get in the sun. You want to get that through your skin. You want to get as much absorption because vitamin D helps to regulate our calcium phosphate balance in our body. It helps with calcification of our bones. It just helps to build our bones. You when we tell like we'll tell little kids like make sure you get your vitamin D in. It helps to build bone structure. Lack of that, it cause calcification of your bones and making it brittle and so forth. So as you age, you want to make sure that you're getting in a lot of vitamin D in because you don't want to have brittle bones, making it easy for you to break and so forth. So, as we said, the sun is a good source of that. It also helps to protect our skin, our respiratory system, and it's found in like meats. Of course, the fish family, like tuna and salmon, has a great amount of vitamin D in it. Folic acid. Folic acid is a form of vitamin B, as we mentioned before. And a lot of moms who had babies, your prenatal vitamin was mainly folic acid because it's a supplement that helps the fetus grows. So it helps with like brain development and so forth. These are found in like wheat foods. It's found in peas, beans, rice, green leafy vegetables. That keeps on coming up. Um, Green leafy vegetables is so vital because it has vitamin K in it. It has iron. So it's a good source. Selenium. So we mentioned earlier that I was going to bring up a mineral that helps our body to not go into the super overdrive. And selenium is good for that. It's just your body, it helps your immune system not to attack itself. So what it does is it aids in this because like if someone has cancer cells, you don't want to send that into overdrive. So what selenium do is just preventing and aiding with your body's immune system not going into that full overdrive. Some good sources that has this is our superfood. I call them superfood because we should never meals without them. That's just my preference. So you have our superfoods. I call them like our garlics, our gingers, our turmeric. I try my very best like now that I'm home on the quarantine. I try my best when I'm making my food that I have those incorporated at all times. I'm trying to mush garlic into everything. Ginger gives our food some great flavor and great taste, great texture. So I like it. And turmeric, you put it on anything, it gives it that color that's so good. So I kind of like it, and they're like real good superfoods. So just trying to incorporate all these. Not every meal plan, as I mentioned, work for everyone. What works for you may not work for me. What I'm lacking, if I'm lacking calcium or something, that may not work for you. So try to get consultation, just medical consultation, or for a registered dietitian, just going over things, your metabolism, get lab work done. to see what your body is lacking and try to get those food groups in that you're lacking. Try to pay attention to your body, pay attention to your mind. Sometimes your body is telling you and telling your mind what's going on, and we just need to kind of stay in tune with that, because our immune system is our well-being, and if we don't protect our overall system, it just makes it like a bigger issue for that. So I think I covered a lot of vitamins. If I'm missing anything, if there's any vitamins that you think I didn't cover, you could always shoot me a question and I'll try to address that at the end of our segment. Oh, before I get into what we do as a company at Detox VIP, I want to mention to you carbs and sugars. Simple sugars. So, simple sugars we know is just a quick boost of energy. Our brain needs energy, our body needs energy for us to get through our day to day. Simple sugars, the problem with that is it gives you that quick boost, but there's a quick crash to it. So, you want to be able to get your complex carbs or something in that it takes time to break down and you're getting your energy source. What is great and a lot of people don't know is fat stored fat that's stored in our body. Our liver converts that to energy when we don't have that sugar source. So that's why something like a keto diet works because for a lot of people is because when you're cutting out that simple carbs, you're making your body work to break down your conserved fat to make energy. And that's what our liver does. So, intermittent fasting, amazing. Because when you go in through intermittent fasting, whether it's like 14 to 18 hours, you're sending your body, you're forcing your body because your brain has to function, your body has to move. It's literally making your body work to break down all those stored fat molecules that we have, telling your liver like, let's break this down, we need the energy, so let's break it down. So that's how something like a keto diet works, which is great for a lot of people. So just keeping that in mind, just supplementing out those simple sugars, and trying to fast. Even if you fast for like a couple hours a day, you don't have to do it all the time because you need minerals and vitamins in your body. But even if you take one day a week where you're saying, okay, I'm going to fast for a couple hours, that does an amazing work. So, what we here at Detox VIP provide to clients, we do thorough medical assessment and we do lab work on our clientele that want to be able to get IV therapy. The process can take place with me or a medical provider. What we do is do a medical assessment. Sometimes we get lab work done if you want something tailored to you, because we could tailor IV bags specifically for a client, or you could buy a packaged bag. There's some pre-packaged bag that's listed on your slide. NAD is such an amazing component. NAD, that's one of our big vitamin bags that we do. NAD helps with DNA repair, molecule, just build the cellular building of cellular blocks. It breaks down your metabolism. So it's a great source for energy. It helps with insomnia, anxiety. One of our biggest thing is it helps with chronic pain. And it comes in like it comes sometimes in a patch format. It's not just IV. It comes in a patch format. It can come in pill format. But a lot of people that take the patch format, it helps with like a chronic pain. So if you have like shoulder pain, it does help a lot with that. It has a positive, negative ion that works. It's great for a pain source. Insomnia, anti-aging. NAD is good for anti-aging because it helps with the building blocks of your DNA. So it's just repairing cells. We also have like our vitamin bags, Zen bags, slimming bags, glutathione, jet lag bag, glow, performance enhancement, just bags that are already pre-made and we could make a tailor-made bag for you. So that's what we do. If we come in, we take an analysis off the person by doing of the client by doing lab work to kind of tailor make a bag for you. If you won't have any more questions in regards to that, you could always ask for us at Carillon Hotel and just continuing this Carillon conversation. You can book or inquire with our service at detoxvip.com, or you could call 1-877-910-9417, or again, you could visit our website at detoxvip.com. Before I go, I want you guys to join me for Feed in South Florida. It's an organization that's helping right now families that are affected with like COVID-19, and they're just trying to make their way out, trying to make ends meet. It's called, they're helping to feed South Florida, so it's Feed in South Florida, and they're doing an amazing work with like even people that have lost their jobs, just providing food supply for people in South Florida. I appreciate the support. You could go online to bit.ly/feed in South Florida. They're doing amazing job. So I'll be grateful if everyone just take a look into that. Support if you can, donate when you can, and I'll appreciate that. And thank you so much, Carillon Hotel, for having me as a guest. Thank you.